So nowadays, the technique for anterior reconstructions are easier than before. And if you check the old composite from Ivoclar, it was called Four Seasons. If you compare to Empress Direct, you understand that the system nowadays is much more simple than was before. So the second challenge that I told you, we have to simplify the technique. And this is something that we understood with Four Seasons, that was the old composite from Ivoclar. We used to have many color and many layers. We used to have a very good result, but basically the problem was that the technique was still too difficult. What we got from this new composite that I told you that is Empress Direct is that we can have still the same very good optical properties, but we have a very simple technique. We use dentin plus enamel, and this is enough. And in many cases, as we can see in this case, if you have thin layers, we just use enamel and you can have a very good result. In this case, I just use Empress Direct A2 enamel for erosion case. This was a patient with erosion on all the anterior teeth, and we just promote the reconstruction with this enamel layer. If I check the third case, this is the third case, I am just changing the composition of the anterior tooth with just one composite, just enamel composite, with a bleach patient. And I like very much this color. There is the XL enamel from Empress Direct for bleach tooth, especially for reconstructions. And if you see, the final outcome is pretty good. So the second challenge that I'm telling you now is that we have to simplify the technique. And this is something that we got already for anterior reconstructions. So this is a very good final result. Maybe in the future, we're gonna also have ways to sculpt the tooth in an easier way. We have a pilot already in the market. The name of this system is U-veneer. You just feel inside this matrix, is like a stamp. You fill this stamp with a composite, and then you put this stamp on the position. And then you can have the sculpture of the tooth promoted by this stamp. This is a pilot. That means you don't have many anatomies, you don't have texture. It's a very simple way. But in the future, I agree that we're going to have more options for this kind of stamp. This is something that could be a very good choice for the clinician, avoiding the sculpture handmade and just by the using of one stamp. In this case, I use this stamp, this matrix, with just one color of composite. It was Empress Direct A1. And if you see the final result, sometimes I think that for a general dentist, it's going to be a very good choice, okay? Just using a simple composite system, and in this case, using some matrix for the sculpture of